I was standing in the holding area of the operating room, approaching my patient for the hour because I was on call for the week. This is a 70-year-old woman. I approach her. She goes, I take a look inside. She has no teeth. She's spitting because she can't swallow because it hurts to swallow. So I knew right away I had a bit of a problem. So I go over and I look at her x-ray, take a look, and I had to hold on. I said, oh my God. The woman had a jaw that was as thick as a pencil and had broken it. So the challenge was going to be to fix this fracture. But the next thought I had was, how in the hell did she get to this point? 70 years old with no bone. She had been drinking her dinners, or probably all her meals, every day for years. This is the end point of a dental cripple. So what's the fast track to getting to this point? Because this is not about fixing the fracture. It's how I can prevent you from getting to this very point. Probably at age 40, she had been going through multiple visits to the dentist for crowns, for bridges, for root canals, and had gotten to a point where she had bought her endodontist, her surgeon, her dentist, a new car. And I had decided, I can't do this anymore. I want all my teeth out. Dr. Grellner, I want you to take all my teeth out. Why would you want to do that? I've had enough. I'm tired of it. I've heard that dentures are easy to take care of, and I want dentures. So that's what my task is. Take her teeth out at 40. She gets a new set of dentures. What happens from that point? Well, probably what happened is 25 years go by. She now has no bone because a jaw ridge lasts about 25 years. At 70, that little bit of bone is even less. So that's one way to get to that point. The second way, the slow way, is Mr. B walks into my office. He goes, Dr. Grellner, I got a tooth that hurts. Take it out. I take a look. The tooth looks like it's fixable. Mr. B, why don't you get a root canal and fix the tooth? No, I want it out. I take it out. What happens? From that point, the bone of the socket may fill in with bone, but the outside of the socket will melt away like a snowman in springtime. So in no time, that ridge has narrowed, it's shortened, and you get a bonus in the upper jaw. The sinus will work its way down into that socket, eliminating the height of bone even faster. So that's the first tooth he's lost. Chances are he's going to continue. Get a toothache, get a tooth out. Get a toothache, get a tooth out. Eventually what happens? I don't have any teeth. There you are. Okay, so what's the solution? Let's start at the beginning. Mrs. C comes in, has to have a tooth out. Mrs. C, how would you like to replace this tooth? Dr. Grellner, I would like to get a dental implant. Excellent. Now, a few things you need to know. This tooth is going to be difficult to remove. You may lose some bone in the process. We're going to do a bone graft to fill the socket with some donated bone. It's going to take 4 months to heal. At that point, we can place a dental implant. But there's a sophisticated way of doing implants now that we do in our office. I can take a CT of her healed jaw ridge, plan the placement of the implant in 3D in different sections, mill a surgical guide that reproduces the angle and the depth that implant will go, so I don't have to worry about drilling into roots, drilling into the sinus, drilling out of the bone because the bone curves in. We place the implant, another 3 or 4 months it heals. She gets her crown, the tooth that goes on that implant, and guess what? That implant will basically preserve that bone from that point on. So she has another way to preserve her bone. Because the whole key to this is once you remove a root from bone, there's no more stimulation from chewing into that bone. So the bone starts to shrink. That's how you lose the gold that's in your mouth, bone. So to get to the root of the matter, you want to keep your bone.